Pediatrics for 10th semester medical faculty. 1. Pediatric Diseases, Infectious Diseases in Children. Acute Respiratory Infections, ARI, Epidemiology of ARI in Indonesia. ARI is a leading cause of morbidity and mortality among children in Indonesia. Higher incidence during the rainy season and in areas with poor air quality. Risk factors include poor air quality, exposure to cigarette smoke, malnutrition, and overcrowded living conditions. Physical examination for ARI. Auscultation, detecting crackles, rales, or wheezing. Signs of respiratory failure. Intercostal retractions, nasal flaring, cyanosis, and oxygen saturation less than 92%. Complications of ARI. Lung abscess, treated with antibiotics or drainage if needed. Pleural effusion, managed with thoracentesis or chest tube placement. Respiratory distress syndrome, RDS, managed with mechanical ventilation and surfactant therapy in infants. Management of ARI, mild ARI. Antipyretics and adequate hydration. Severe ARI, antibiotics, bronchodilator nebulization, and oxygen therapy. Acute diarrhea epidemiology and pathophysiology, often caused by rotavirus, norovirus, or bacterial infections, e.g., Escherichia coli, Salmonella. Rotavirus damages enterocytes in the small intestine, disrupting fluid and electrolyte absorption and causing osmotic diarrhea. Classification of dehydration. Mild dehydration, fluid loss less than 5% of body weight. Moderate dehydration, fluid loss 5 to 10% of body weight. Severe dehydration, fluid loss greater than 10% of body weight. Nutritional approach in diarrhea. Continue breastfeeding in infants. Administer zinc, 10 to 20 milligrams per day, for 10 to 14 days to accelerate recovery. Probiotics like Lactobacillus rhamnosus can help speed up recovery. Complications: severe dehydration leading to hypovolemic shock. Malnutrition due to nutrient loss. Management: oral rehydration therapy, ORT, with WHO-recommended solutions. Intravenous rehydration with Ringer's lactate for severe dehydration. B. Chronic diseases in children. Asthma epidemiology and triggers. Genetic factors, exposure to house dust, animal dander, viral infections, and air pollution. Asthma can also be triggered by physical activity or stress. Long-term management. Inhaled corticosteroids, ICS, first-line preventive therapy. Long-acting beta-agonists, LABA, for children with severe symptoms. Desensitization immunotherapy, for clear allergen-induced cases. Malnutrition epidemiology, includes wasting, acute malnutrition, stunting, chronic malnutrition, and underweight, low weight for age. Main causes: poverty, maternal malnutrition, and chronic infections like TB or HIV. Pathophysiology: marasmus, total energy deficiency, leading to muscle and fat tissue loss. Kwashiorkor, protein deficiency, causing peripheral edema and hair loss. Nutrition rehabilitation protocol: stabilization phase, managing dehydration, infection, and hypoglycemia. Rehabilitation phase: providing therapeutic foods like F75, rehydration, and F100, rehabilitation. 2. Immunization: a national and supplemental immunization schedule. Mandatory immunizations: hepatitis B, administered within the first 24 hours after birth. BCG prevents severe tuberculosis, given before 1 month of age. DPTHB-Hib prevents diphtheria, pertussis, tetanus, hepatitis B, and Hib meningitis. Supplemental immunizations: rotavirus prevents severe diarrhea in infants. HPV to prevent cervical cancer, initiated at ages 10 to 13 years. Influenza annual vaccination for high-risk children. B. Side effects and management: mild side effects, localized pain, mild fever, and redness at the injection site. Severe adverse events: AEFI, anaphylaxis. Treated with intramuscular epinephrine 0.01 mg per kilogram body weight. Febrile seizures, managed with antipyretics like paracetamol. 3. Child growth and development: monitoring growth with WHO growth charts. Addressing developmental delays like speech disorders or autism. 4. Pediatric emergencies: shock, administer 20 ml per kilogram Ringer's lactate bolus. Febrile seizures: use rectal diazepam or intravenous lorazepam. 5. Neonatology: low birth weight, kangaroo mother care, KMC. Neonatal hypoglycemia, treat with IV dextrose. 6. Pediatric neurology: epilepsy, antiepileptic drugs like phenytoin or valproic acid. Bacterial meningitis, empirical antibiotics, ceftriaxone or cefotaxime. 7. Pediatric cardiology: cyanotic heart defects. Surgical correction for tetralogy of Fallot. Non-cyanotic defects, interventional catheterization or surgery for VSD, ASD. 8. Pediatric hematology: anemia, iron supplementation for deficiency or blood transfusions for hemolytic anemia. Leukemia, chemotherapy for all or AML. 9. Pediatric endocrinology: type 1 diabetes, insulin therapy and nutritional management. Congenital hypothyroidism, lifelong levothyroxine therapy. 10. Pediatric psychiatry: ADHD, behavioral therapy and methylphenidate. Childhood depression, psychotherapy and medication if needed. Summary. This comprehensive coverage of pediatrics spans acute and chronic illnesses, growth and development, immunization, and specialized care for neonates and children with specific conditions.